Hello everyone, I'm your host Dr. Purvi Deshmukh, and together we are going to dive deep into the topic that affects millions of people worldwide: kidney stones. Painful, common, yet misunderstood. To help us understand better about kidney stones, we have with us Dr. Rajiv Shetty sir, lead consulting urologist and head of department at United Hospital and Matoshree Kidney Stone Center. Thank you for joining us, sir.
Thanks, Dr. Purvi. Thanks for having me here. Many people suffer from kidney stones, and since it's being a very common problem, I am very happy to share my thoughts about prevention.
So let's start it simple. What exactly are kidney stones?
See, basically kidney stones are nothing but they are deposits of calcium and some other minerals and salts which gets excreted into the kidney. They get deposited there, and over a period of time they become big to form kidney stones.
So, how common are these stones in general population?
See, kidney stones are extremely common. If you randomly pick up some 10 people and do ultrasound scan, at least 2 to 3 will have some kind of stones in the kidneys. Yeah, it's that common. Yeah.
So why exactly these stones form?
See, one of the very common reason why a person forms stone is consumption of less water intake. Okay, when a person consumes less water, that person is at a higher risk to form stones. Suppose if a person is not taking adequate water, these minerals, they tend to get crystallized to form stones.
Okay, over the time.
Over a period of time, yes. So once the crystallization happens, over a period of time, these crystals will become stones.
Can you highlight few preventive aspects or the advice that you give to the patient?
Yes. See, prevention is a very important aspect of treatment of kidney stones, because as I said, once there is a kidney stone, the person has a very high tendency to form one more episode of kidney stone in another couple of years, say around 2 to 3 years. So these preventive aspects are very, very essential. Now I'll discuss only those things which are very, very essential and very important and easy to be followed. The first aspect is adequate hydration. A person should drink at least 200 to 250 ml of water every hourly from the time he wakes up in the morning till he goes to bed. This is the most simplest, easiest, most effective way to prevent any kidney stone formation. If a person follows only this one recommendation, 70% of his chances of recurrence will go down. Yes, this is the most important thing. Now, when I see patient, when I tell them to drink water, patient generally says, "Doctor, I drink 4 liters of water every day, but still I am forming a kidney stone." But when I ask them, "How do you drink?" they say, "Doctor, I drink 2 liters of water in the morning and again 2 liters in the evening." See, this doesn't help. Very important is to split that water intake. The body has to be hydrated all the time. If you drink 2 liters in the morning and 2 liters at night, that 4 liters is not going to help. So that's exactly the reason why a person should drink 200 to 250 ml every hourly over period of time from morning till evening. Yes. The second most important thing is for people who consume non-veg. Non-vegetarians will have a higher tendency to form stones. When I say non-veg, specifically red meat and organ meat. So it's always a better option to stop consuming non-veg. If they can't stop, at least they can reduce the consumption. Simple suggestion I give them is, suppose if they are taking 4 times in a month, they should reduce it to once in a month. Third most important preventive aspect is the consumption of sugar and salt. These patients should restrict their sugar and salt by 50%. Anyone who is consuming excess of salt, for example in the form of pickle or any junk foods, any stored foods, canned foods, they all contain very high sodium, and equally with the sugars as well. Anybody who is consuming excess of sugar in the form of either sweets or chocolates or ice creams, these has to be cut down. The fourth most important and simple thing is to drink 1 glass of any citrus fruit juice per day, 1 glass per day. Either a lemon juice, which is very commonly available, 1 glass per day. Okay, this has to be consumed. Then fifth preventive aspect is anyone who is consuming excess of green leafy vegetables, they should cut down on that. Again, most important, I will not tell them to stop consuming green leafy vegetables because they are very, very essential part of our diet. They should not stop consuming it, but they should reduce its consumption if they are taking them in excess. Suppose if someone is consuming green leafy vegetables like palak, for example, on a daily basis. So we suggest them not to take them on a daily basis, but they can comfortably have them once in a week or twice a week. If you are already taking once in a week or twice a week, there is no need to stop them. Many people ask about tomatoes, very common. Some people say they have completely stopped eating tomatoes. Some people will also say that they go to an extent that they remove the seeds from the tomatoes and then they prepare. Absolutely not. This is not required. You can have tomatoes, but don't eat excess of raw tomatoes. Whatever you put it in the vegetables, that is totally acceptable. Then many people will ask whether they can take calcium supplements. Calcium supplements can be taken, but yes, they should be taken along with the food. They should not take them on empty stomach. Then next thing is, people, in fact, when they know that they are forming stones, they intentionally stop eating calcium. If they stop eating calcium, they in fact form more stones. So the person should normally eat calcium, what is normally required for the body. So the next preventive aspect is the physical activity. We tell the patient to do regular physical activity, either in the form of jogging or playing some games like badminton or skipping or spot jumping, of course in people who can do these things, not in elderly people. So these activities are very, very essential to prevent the stone recurrence in the form of, if a stone, for example, if it gets formed also, in spite of we taking all these precautions. So these physical activities will make the stone to pass out when it is small only. So that's the reason why we should do this activity. And last and the most important, any person who forms a stone, they should make sure that they should get an ultrasound scan done once in every 6 months to 1 year. They should not forget this. But generally what people do is they do a scan only when they get a pain, which is very, very wrong. So they should get a scan done once in every 6 months to 1 year. So by following these recommendations, there is a very great chance that a person will not form a stone again.
So what's your take on beer and kidney stones?
Yes, very good question. See, many people think that by drinking beer they can prevent stone formation. Actually, it's a myth. The reason is, beer contains a lot of oxalates. If a person consumes beer on a long-term basis, they in fact are harming themselves by promoting kidney stone formation. But yes, if the patient has a small stone which is stuck in the ureter, beer may help to expel the stone out, because beer is basically a diuretic. What is diuretic is anything which increases the urine output is a diuretic. So, but still the beer is not a treatment for this. I don't recommend to drink beer just to make the stone pass out. What I say is, instead of drinking 1 glass of beer, you drink 3 glasses of water. It does the same work. So it's a common misconception that beer prevents stone formation. No, it's not. Yeah, it will help, but it in a wrong way basically. So the alternative for this is, as I said, 1 glass of beer, drink 3 glasses of water. The job is done. Yeah.
What would be a quick takeaway for all the viewers?
Prevention, prevention, prevention. Water, water, water. Regular screening.
As our doctor said, the prevention and the screening and drinking lots of water is the best part to prevent the kidney stones. Thank you so much for giving us such valuable and detailed information about kidney stones. Dear viewers, please watch out the space for more such detailed urological videos. Thank you.